For this video, we're going to talk about the anatomy and physiology of the knee joint. We're going to cover the important key muscles and ligaments and tendons that cross the knee joint, help to move it, and help to stabilize it. To begin with, the knee is composed of three different bones. You have your femur bone, which is your long bone in the mid-thigh that sits on top of your tibia, your shin bone. Beside your tibia, you have your fibula, which is the lateral little bone. These three bones make up your knee joint. The knee joint is then surrounded by a capsule. In this capsule, you have your synovial fluid. And where the synovial fluid is encased, the very ends of those long bones have cartilage on there. And those cartilage also have meniscus. So this is your shock absorption of the knee. Additionally, you have your four primary ligaments. You have your MCL on the medial side of your knee, your LCL on the lateral side. So these are your collateral ligaments. Your anterior cruciate ligament, your ACL on the front, going to the back, and then your PCL, your posterior cruciate ligaments. So these cruciate ligaments make up the kind of crossing in the knee joint. You then also have some very important muscles that help to stabilize the knee. You have your quadriceps muscles, which is four muscles that come into your patellar tendon, go through over your kneecap and then to your tibia. You have three primary hamstring muscles, your sebimembranosus, your sebitendinosus, and your biceps femoris. And then you have your gastrocs, so part of your calf. Your gastrocnemius has two heads that cross the knee joint, and then you also have your adductors, which help to stabilize the knee laterally. So all these muscles, bones, and ligaments work together to have a functional knee. So your knee is good at flexing and extending. So those are the two primary movements of your knee joint. You also do have a bit of medial and lateral rotation, which helps to supplement your ankle movements and your hip movements. Important ranges of the knee is being able to achieve 0 degrees of extension and being able to flex about 120 degrees. This is because it's important for walking during heel strike and for maximally climbing upstairs and doing a squat. The next video is going to go into more of the knee pathology and some different common conditions you can see that affect the knee joint. Thanks for watching. Please like and subscribe and leave a comment below of something that you'd be interested to see next. Tune in next time.